Hello, my name is Catherine Lucas. I am a neonatal nurse practitioner and a doctoral student at the Duke University School of Nursing. I have been practicing as an NNP for 10 years, and I have been a registered nurse for 20 years. I would like to speak to you today about the role of nursing in policy making. Registered nurses represent the single largest group of healthcare providers in the United States. We occupy positions encompassing all areas of healthcare that are in close proximity to patient care. The variety of positions occupied by registered nurses gives our profession a unique perspective that is valuable to inform policy. Registered nurses are highly educated, ranging from associate's degree to doctorally prepared nurses. Our role in the healthcare team is dependent on the positions that we hold, but managing patients is one of our largest roles. It is essential that we understand disease processes, expected patient changes, and that we react appropriately to any findings. Nurses spend 8 to 12 to 16 hours per day at the bedside with the patient, and our contribution to patient outcomes cannot be overlooked. However, nurse contributions and our value added to patient outcomes are poorly measured, marginally recognized, and often absent. As an example, Pay for Performance demonstrates projects funded by the Centers for Medicaid and Medicare Services and have focused exclusively on physicians. Advanced practice registered nurses, such as nurse practitioners, certified nurse anesthetists, and certified nurse midwives, practice patterns and outcomes support the fact that our patient outcomes are highly rated, and this continues to be overlooked. Policymakers have historically relied on sources other than nursing for input and advice in policies regarding patient care. These policies more often than not affect nursing, yet we are overlooked as experts in the policymaking process. Physicians, pharmacists, and hospital executives are valuable proponents in making these policies. However, the expertise brought by registered nurses is as valuable. Nursing is a licensed profession that is minimally involved in the policy-making process affecting our own profession. Our practice is governed by the regulations and legislation determined by a body that is not represented or underrepresented by nurses. Policies made regarding nursing and patient care will ultimately impact and be impacted by nursing. This should impress upon policymakers and you the importance of requiring nurses in the process of developing health policy. Despite numerous theories, models, and philosophies describing what nurses are and what they do, nursing care is often presented as an apolitical process. Our focus on patient needs and priorities is recognized, but our involvement in research, policy, and outcomes continues to be overlooked. We possess a specialized form of knowledge that is used to alleviate current or future physical, psychological, and emotional distress. This is one of the many ways where nurses are noticed as working in the best interest of each individual, family, and society. Registered nurses can contribute to the development of health policy by bringing their nursing perspectives along with an often broader biological and scientific perspectives. Bringing registered nurses to the table helps to expand the discussion necessary to produce quality health policy. Society holds nurses in high esteem, not because of the numerous creative and esoteric ways in which we conceptualize the profession, but rather because of the tangible benefits that nurses make in people's lives every day. People hold nurses in high regard because they provide health care. Nurses address health-related problems through the methods of systematic assessment and then apply a specialized knowledge set to combat the identified area of concern. The ultimate goal of promoting health and preventing illness and disease across a lifespan remains a constant in nursing. Nurses are political agents both as researchers and enforcers. As we guide and direct patients to promote healthy living, using evidence-based practice. Nurses are positioned as trustworthy, honest, and caring individuals. We work with individuals to assist them in optimizing their health by providing education and strategies for healthy living. Engagement of nurses in national policy and decision-making will facilitate advancing successful policies in the health and health care. Nurses are represented in numerous organizations. Within most of these organizations are political action committees that are actively engaging policymakers regarding health, health care, and nursing. I recommend that you actively engage with nurses and that you encourage and support our active participation in policy-making process. I am asking that you determine what nurses are and that you demand we are representative in a positive and professional light, and that you encourage and support our active participation in the policy-making process. You can do this by talking to one another or by contacting your local and state representatives. Find out if they understand and if they share your beliefs and values about nurses, and encourage them to support nursing and getting to the table. Thank you.